There is no reason why two African countries, for example, account for over 60% of the global production of cocoa, but they don't make any chocolate in Africa, in these countries. And if you look at the value chain, cocoa they make maybe about $45 billion, but the global chocolate market is over $100 billion. And when you come to medical industrialization, again, as a business, as an industry, in many countries, on average, the healthcare industry is maybe accounts for about 17 to 19% of GDP. In most African countries, about 3% of GDP. So that's a huge room for growth. And the only way you can bring about that growth is through industrialization.
My pleasure to welcome you to your first Curated Conversation series of Nigeria Health Watch. This is a conversation where we speak with health experts and leaders who are contributing to shaping the global health agenda, addressing global health issues in various ways, which we know is multifaceted. And I'll really start with an introduction of yourself, if you could tell us who you are, and we kick off.
My name is Abdu Mukhtar. I'm the National Coordinator of the Presidential Initiative for Unlocking the Healthcare Value Chain, otherwise known as PVAC.
Fantastic. Nigeria is at the critical inflection point. The health sector is pushing for bold reforms, and against the backdrop of shrinking development aid, the ever-increasing health demands, and there's this growing commitment for to harness our domestic resources, to unlock the healthcare value chain and the healthcare ecosystem, which you sit right in the middle of. And I think we'll start off the conversation with a bit of a reflective question from your perspective, as you've been at the forefront of leading medical industrialization on the continent for about a decade now, and right from your time at the Africa Development Bank to now leading PVAC. What would you say is your commitment, or how would you describe your motivation to working in this space?
Yeah, okay, so since you started with FDB, I will start by talking about industrialization in broad terms.
Okay.
When people talk about industrialization, you look at countries, the Asian countries, the Asian tigers, and how they've been able to industrialize. And there's often this comparison that many African countries were at one point at par in terms of GDP levels and GDP growth with those Asian countries. And so the question that you ask myself is, how did these countries move ahead of our own countries? But then when I started looking at this, I realized that, industrialization is not rocket science. You just have to do a few things in the right way. You have to make sure that you have the right policies, the right laws. You have to put the right infrastructure in place. You have to build the human capital. You have to access different financial instruments, and then create markets and build, the research and development capabilities. So it's not rocket science. So I've always been driven by this understanding that Africa and African countries, Nigeria, we can do this. There is no reason why two African countries, for example, account for over 60% of the global production of cocoa, but they don't make any chocolate in Africa, in these countries. And if you look at the value chain, cocoa they make maybe about $45 billion, but the global chocolate market is over $100 billion. So we're driving a lot of value. We produce a lot of cotton, but we import jeans, so the value is captured elsewhere. So industrialization has always been a topic that has fascinated me, but also understanding that it's just really to do the right thing. Now, when you come to medical industrialization, again, as a business, as an industry, in many countries, on average, the healthcare industry is maybe accounts for about 17 to 19% of GDP. In most African countries, about 3% of GDP. So that's a huge room for growth. And the only way you can bring about that growth is through industrialization, making sure that you create that value. Coming back to Nigeria, for example, the life sciences market that we're trying to address is about $46 billion. That's a huge market, but it's also projected to grow to almost $20 billion in the next couple of years. So there's this huge opportunity. But the last straw for me was COVID. when COVID hit in 2020, during the work that I was doing in the African Development Bank, I saw how really vulnerable and exposed most African countries were. We're running helter-skelter to buy basic personal protective equipment, PPEs, gloves, masks, and the basics. And because countries were shutting down, so even essential medicines that we needed to treat people with HIV, with malaria, those kind of things, we couldn't get them because we're heavily dependent on other countries. So for me, is that desire to say, look, this cannot continue. We have to make a change as Africans, as Nigerians, but also just saying we can do this. And again, it's not rocket science. You just have to identify what needs to be done and just do it consistently.
Fantastic. I think it was important that you touched on COVID. So many statistics will say that Africa imports about 99% of its vaccine needs. And of course, similar things around therapeutics generally. So last year, we saw the President Tinubu, he signed a landmark executive order. It really seeks to address some of the things you mentioned, the fact that to unlock our healthcare value chain, basically, and increase our capacity locally. And so would like to get more insights on that, on how it's been implemented. Last year, when we last spoke, rather, was just when it was rolled out. And now it's almost a year since its rollout. So we'd like to get updates on what the progress has been so far and what the obstacles you've navigated in implementing or leading the implementation of this executive order.
Yeah, thank you. So the executive order is one of the policy interventions that we recommended to His Excellency Mr. President Bola Ahmed Tinubu, and kudos to him and to his leadership. He signed it, and it's really very important. And looking at the rationale, why did we even come up with the idea of that executive order? When you try to build the private sector, what you want to do is to make the private sector competitive. You don't want to, there will always be people who want to import. And if you can import goods and products, medicines, cheaper from other places, there will always be that competition. So we're not trying to import substitute. This is not an import substitution play. This is a play. What we're trying to do is to make our own manufacturers competitive so that they can compete globally. Now, when we did our analysis to see what does it take to produce one tablet of medicine, and we have that really detailed analysis to that level for each of the medicines and other products, looking at the cost of production, we realized that so there are issues around power. If you produce, how much does it cost for power per tablet, those kind of things. Just applying some policy things around fiscal incentives, around taxation, we realize you can actually reduce the cost of production of most healthcare products by about 12%. So it's a very targeted, analytically driven intervention, that executive order. So if you produce based on the implementing the provisions of the executive order, which have several components, but the fiscal parts of the component are zero duty, zero VAT for raw materials and equipment and machinery for local production. Just doing that will reduce your cost of production by 12%. So now you make your own producers, manufacturers competitive against imports.
Yeah.
So this is what we're trying to do. Now, since inception, since the president signed that order, we've actually been working with customs. There is a technical working group that is looking to make sure that this is being implemented as approved by the president. I just got a report 2 days ago, so you're probably the first person to hear this. Just we have a dashboard from customs that is looking at what is the total, who is taking what, and all of that. Between March, I think from March 5th this year, so from March to middle of July, this is where the data that I got. About 54% of the companies on the list. So when we did the executive order, when we went to customs, there is a list of about 200 plus companies that are eligible based on certification by NAFDAC, but also a list of about 774 products that are eligible for exemption under the executive order. So looking at that, the data for now, how many months, about from March to July, mid-July, it shows that about 54% of the companies on that list have actually tapped into. So basically, they have approached customs. They got waivers for machinery, raw materials, and this is huge. It's already, that means it's already been done. In terms of total value, I think it's about 6.2 billion naira that has been in tax that these companies would have paid. So this is money that now they keep, and it makes them more competitive. And when you look at what categories of drugs, it's mostly APIs, active pharmaceutical ingredients, for paracetamol, for antihypertensives, for anti-diabetes, for antibiotics. These are drugs that we use every day in this country. So really, if you see, and you will see, prices of drugs falling in this country over the next couple of months, this is a direct result of this intervention, because now the cost of production is lower and therefore the price will be lower. So this is a long way to say to you the executive order is working very well. We thank the Ministry of Finance under the leadership of the minister. We thank customs and all the agencies that are really part of this, because again, this is not one agency. Dr. Pate, the Minister of Health, has played a very key role in providing the leadership, but this is an all of government initiative that is working very well.
Oof, that's fantastic, actually. What about, it's good to see that there's some measurable and recorded outputs or outcomes that we are starting to see also. But what about the obstacles? What obstacles could you point to that could perhaps hinder the achievement of these successes that you envisage?
Yeah, I wouldn't really call them obstacles, but every policy intervention comes with this. When you do policy, you always then see things that we probably didn't see when you're implementing the policy. So this is usually part of the whole policy space. What you do is to understand what is working very well and what's not working, and try to adjust and improve on that. Some of the things that we're seeing is, first of all, more companies are coming and saying, we also want these exemptions. So it's important for companies to know that, everybody, this is a level playing field, but you have to be a manufacturer. So there are people who are just importing. They are not manufacturing, but they say we are importing raw materials for this. So these raw materials, so they typically import raw materials in bulk and sell to the manufacturers. So they're now asking the question, why can't we get those waivers as well, even though we are not manufacturing? So there are those kind of issues that have been coming up, and we're working with relevant ministries and so on. The other issue is the issue of equipment. So the executive order has addressed machinery and equipment and say you can get exemption for those. But when we're doing this, the Ministry of Finance pointed out to us that there is also a separate window called IDEC that the Ministry of Finance and Ministry of Trade and Industry they have been implementing. So when you import machinery and equipment for any form of production, whether in healthcare, agriculture, that has always been a policy through a window, import duty exemption certificate that is called IDEC, that is being applied. So when Finance Ministry was transmitting the list of equipment and machinery that we put together, they removed those items. They say, well, these are already being addressed by IDEC. There's a separate window, there's a separate part of government that is doing this. So now many of our manufacturers are coming to us and say, well, IDEC, it's not working very well, this should have been part of this, So again, we're talking to finance, but also trying to work together with industry and all the relevant agencies to make sure IDEC is also working, not only for pharmaceutical manufacturers, but also for all manufacturers in Nigeria.
That's interesting. Actually, not surprising that some policies would have encountered some of these issues. So one of the issues that you have experienced is, importers who are not manufacturers, importing some of these raw materials and, trying to sell to the actual manufacturers. And it's safe to assume, perhaps correct me, that might be a financing challenge on the part of the manufacturers, right? So I'm interested to know how PVAC is working with relevant ministries like finance, like you mentioned, trade and budgeting, to expand or to enhance financing to some of these manufacturers who might be in need of them to import adequately and to avoid middlemen.
Yeah, so we do a lot of financial intervention is one of the things that we do. But to be frank, when we look at that, we're not really focusing only on importing. we're also looking at actual investments, not only importing raw materials and do, because again, the idea is to industrialize. So you want people, manufacturers to establish, to expand capacity locally. We have been mobilizing resources. So the way PVAC is designed, we are not one of those intervention programs where we get a lot of billions from government and then we channel into manufacturers that want this. What we do is to mobilize resources from relevant agencies. And manufacturing is a long-term process. You don't want to borrow money to do manufacturing 5 years. And so it's a long time. You need 15 years, 20 years. So we're focusing and working mostly with the DFIs, the Development Finance Institutions. And we made a lot of progress. So Afrexim Bank, for example, over a year and a half ago, Dr. Professor Mohammed Patel, Minister of Health, signed an MOU with the president of Afrexim Bank for a $1 billion facility. We have signed a similar program with the European Investment Bank for 1 billion euros. We're talking to the African Development Bank. We're talking to Bank of Industry. What we're trying to do is to make a commitment to Nigerians to say, if you have a good, bankable, feasible business, the money shouldn't be a problem. The money is not with us. We're not taking money and writing you a check. But if you have a good project, we'll talk to these people. We know what they're looking for, the kind of things that they ask, the questions that they ask, and then we match you. And we've been doing that over the last 1 year with significant results. We have in our pipeline about 75 companies, projects. A lot of them manufacturing, a couple of hospitals, digital health solutions that we are already prepared. And one of the services that we provide is also to help these entrepreneurs and business people to make the projects bankable and feasible. Help you with how do you get feasibility study done, how do you even write a business plan, and those kind of, so that by the time you approach the banks, that funding is available. A lot needs to be done in that regard. Now, part of the challenge is many of these institutions we're talking to, they're looking for big projects, $30-50 million. Most of the requirements that we see, the demand that our companies have, they just need $2 million, $3 million. So how do you create a mechanism where you get this money, but also you support these small entrepreneurs? We are looking at using intermediaries. So Bank of Industry, for example, we've been having a lot of discussions to see how we can move, let's say, $200 million from European Investment Bank or from Afrexim Bank into a Bank of Industry, specifically targeted at healthcare companies and manufacturing, pharmaceutical manufacturers, ring-fence that money, have different criteria from what BOI is using, and then BOI can now give the 1 million, the 2 million to these people, because these banks are not going to be giving that 1-2 million to this. But if you get a big package that you work with institutions like BOI, we are talking similarly to the Nigerian Sovereign Investment Authority to do that. So these are all the things that we are trying to look. Our job in PVAC is really just the way it says, to unlock. And so wherever we see issues, wherever we see potential challenges, we try to find the right solutions so that those solutions are available and manufacturers can tap into it.
That's great. It's one thing for PVAC and the Ministry of Health to access this financing and they secure these incentives through the executive order, for instance. It's another thing for it to translate into public good. So I think another thing we'd like to know is, what are the accountability mechanisms that are in place that you use to ensure that these market players that benefit from any of these packages, it translates into public good?
Yeah, look, I think you hit at the heart of the matter, which is your accountability, which is absolutely key. So first of all, if you're an institution and providing money, you already have your mechanisms, in-house mechanisms, to make sure that the money is being used the way it should be used, right? In our own case, we have monitoring and evaluation frameworks, M&E frameworks, that we monitor ourselves to make sure that we are also held accountable, because accountability, as far as I'm concerned, is not only to the manufacturers, also PVAC, that we're doing the work that we should be doing, and we are calling all Nigerians to hold us to account in all our actions and what we do. We again, depending on what it is, if it's on financing side, the owners of the capital, whether the financial institutions, they will always have ways to do that. But we also have ways to check and balances. So I talked about the executive order earlier, for example. These numbers that I got, that I told you, the dashboard, we're actually going in the field very soon to verify. So if you're a company and saying, oh, I'm importing these because I need to do, you're getting tax waivers. This is a lot of money that should otherwise gone into the government coffer. So are you sure that you're actually importing those raw materials? So customs, of course, is doing that at the ports, and that's their job. But also we want to make sure that when it comes to your factory, you're actually producing these medicines. But more importantly, that it really leads to a decrease in your cost of production. And that should also translate into lower prices. So if we're giving you all these incentives and your prices remain the same and drug prices are going higher, then it doesn't make sense. The essence of some of these policies, of course, is to reach down to the grassroots so that Nigerians can benefit in terms of lower cost of drugs, but also improve quality. Because one of the things that you're doing, if you have a few manufacturers that you're working with that you hold to account, then even issues around quality, fake drugs, you can control that to a large extent.
That's interesting as well. I see there's a lot happening in the midst of all these impressive health reforms and agenda that PVAC is driving. There's also the challenge of the decline in development aid. And I'm curious to know how this has somehow affected Nigeria's push towards medical industrialization and how the country is adapting its financing architecture, to in the wake of this declining development assistance, and to ensure that the president's vision through PVAC is actualized.
Yeah. So look, you must give credit and commend His Excellency Mr. President Bola Ahmed Tinubu and the Honorable Coordinating Minister of Health, Professor Mohammed Ali Pati, because they were very, very proactive, as if they knew that this was coming. Even the executive order that we're implementing is really just one of the ways to is think ahead and make sure that you have availability of some of these products. When we had the cut in U.S. government funding, for example, and lower development aid in general, we were already thinking ahead, as part of the agenda. How do we mobilize domestic resources? So a typical example, as soon as the U.S. government announced the cut in ATM, AIDS, TB, malaria funding, within 2 to 3 days, the president approved $200 million to procure those commodities for Nigerians to avoid, the death of almost 1.3 million Nigerians who are on antiretroviral therapy, about 400,000 Nigerians on anti-TB medication. So there was a very clear, decisive action to say there are resources at that. So there is money in the budget that we are actually implementing in PVAC, that procurement process to acquire those medications. But that procurement is also tied to the whole agenda that you mentioned. So we will use our resources to buy products from manufacturers locally. So the whole agenda of mobilizing local production is, if there is local production of any commodity in the space, we're using Nigerian government resources, then we'll buy from local manufacturers. Unfortunately, many of these products are not produced locally. So the next step for us is to buy from manufacturers globally that have already an intention to localize in Nigeria. And that intention is not just by mouth. That is demonstrated, clear commitment. And we know who they are. We've been working with many of them. We've signed memoranda of understanding and agreements. Some of them have identified local partners to transfer their technology to. So we are already working with those manufacturers to say, look, we'll buy from you wherever you are, but we want to make sure that in the near future, maybe 2 to 3 years, that you come and localize many of these products. So this is what we are doing. And that the president also made a very bold declaration recently that said Nigeria first, meaning not only in healthcare, that every product, whenever Nigerian government resources are being used for procurement, will buy from local manufacturers. This is going to change the game, because this manufacturer, they put in money, they invest, they want business, they want markets. So if we're getting money from elsewhere, people or countries or organizations can insist on buying from certain manufacturers. Now that we're using our own resources, then now we have the freedom to buy from anywhere, make sure that the products are high quality. And I want to state this very clearly. Our drive for local manufacturing, local production does not and should not in any way mean lower quality products. Nigerians deserve the best quality, highest quality products, and we can produce those products in Nigeria.
Well, I think this has been interesting so far. You've been, from your experience at the FDB, up to leading, one of the most ambitious health reforms, which is the presidential initiative on unlocking the healthcare value chain. You've really seen the heart of medical industrialization on the continent. So I think the question now is, what has been one, moment or experience that has reaffirmed your belief that Nigeria can become the medical industrialization powerhouse that the president aspires it to be, also recognizing that Nigeria's win, or when Nigeria wakes up, like they say, the continent would wake up. And of course, this aligns with the most recent Accra Compact that was endorsed about 2 weeks ago.
It's difficult to ask me for one critical moment. So I'll give you two critical moments, and these are not like really exact moments. So look, to do all the things that we're doing and all the progress that we've been doing is you need the political will, the support at the highest level of government. So for me, the first critical moment is really just the political will and support that we're getting from the president, President Bola Ahmed Tinubu, from the Honorable Coordinating Minister, Dr. Pate, from all the leaders in government. That is really key. When you see the commitment and when you talk to the president about executive order and he says to you, bring it tomorrow, I want to sign it. That is a critical one. That shows that we are actually on the right path, that this can be done. So for me, that's one. The second critical moment is you need the manufacturers, you need the business people, you need the entrepreneurs. When I go out on the field and I talk to people, these manufacturers, with all the difficulties, the challenges, and you see their commitment, their passion for what they're doing, you know that Nigeria can industrialize. In December last year, we launched a beta-lactam antibiotic facility in Lagos by Jawa Pharmaceuticals. In May, we were in Ogun State. We launched a test kit, rapid diagnostic test facility by Codex Bio. You look at what they have set up. I was in Kano for a few days. I met with really amazing entrepreneurs, including young people, young engineers, finding innovative solutions. When you see these things out in the field, and there are many stories like that, you know that this can be done, and Nigeria can actually lead this across Africa and for the rest of the world even.
Thank you so much for joining us on the Curated Conversations series, and hope to see you again next time for more updates from the important and critical work that you're doing, Dr. Mukhtar.
Thank you very much, Emeka. Thank you for having me.
Well,